Hey, joining us once again in studio, Dr. David Klein of the Stages of Life Institute, right there in Longwood, but you can always reach them at stagesoflife.net. Now, Doctor, you said you wanted to talk about bacteria today, and bacteria in my intestinal tract and my gut. What is bacteria doing down there?
Our little friends, outnumber us. There are more bacterial cells in your gut than you have cells in your body by a factor over 100.
Is that good?
Well over 100. Well, it all depends on whether or not you're Custer at the little big stand, or the little bighorn. No, it works a little something like this. Those bacteria in your gut, and there are many, many different types of bacteria in your gut, are there for a reason. Mm-hmm. They were supposed to be put there when you were born. When you went through the birth canal, that was when you were supposed to be inoculated with these bacteria that will then form colonies and so on and so forth that develop through your entire life. And what they're starting to find, in fact, they've known this for many, many decades, but they're starting to explain the phenomenon now, is that individuals that were delivered by cesarean section have a very, very different lifestyle that follows. They have a higher incidence of asthma, higher incidence of allergies, higher incidence of autoimmune disorders, higher incidence of neoplasm, from just simply being born the other way. Why does this happen? So the studies are now getting more and more interesting because they're looking internationally at the different types of colonies of bacteria in your gut. What happens is this, is that you need to have both good bacteria, good viruses, good mold, basically yeast, in your gut in order to protect you from pathogens. They fight for certain nutrients. More so, the bacteria actually helps you digest your food. Were it not for the bacteria, we would probably be very, very ill. And in fact, that's pretty much what happens, and there's a tremendous industry that's now being developed looking at something called probiotics in order to have people recolonize their gut. Our gut is not exactly the same as your septic system. If you go ahead and you dump Rid-X into your toilet, so that way you can recolonize your septic system. If you live in an apartment, you wouldn't know anything about this. If you live in a condo, you might know anything about this. But that's the way septic systems work. The bacteria, the good bacteria that's supposed to be pooped down the chute, as it were, will then tear up the debris that's in there and allow it to enter the nitrogen cycle. It becomes part of the environment in a good way. Well, guess what? When you have a laundry detergent, when you have soap suds, you shower, you shampoo, it changes the bacteria in the septic system. So sometimes you need to dump bacteria down there, Rid-X, in order to restore the balance. But your gut is far more complex. There are 150 to 200 identified bacteria, good bacterial agents that are there for a reason. When we use these probiotics, you're not going to get the right mix. Oddly, you're going to find this to be as disgusting as I do, but there are people out there doing fecal transplants now, as a shortcut to restore the bacteria in your gut.
Oh, my word.
And it lends itself to all kinds of off-color jokes, I've got to tell you. The very thought of having somebody feed you somebody else's poop, I find that to be repulsive. There are people out there, I'm sure, that would not. However, the trick in this life, is to not need such type of intervention. So what do? We avoid willy-nilly antibiotics. And you're going to think that seems like a simple statement, but more antibiotics are prescribed probably by a factor of 10 than are necessary for people's livelihood, to live, to survive, to thrive. Patients go to the doctor's office with a sore throat, and they're not happy if they don't walk out with a prescription for Frogmentin. They're not happy if they have a cough and they don't go out with a prescription for Cipro. They're not happy if they don't walk out with a Z-Pack. And the doc would be wasting his or her breath to try to explain to you why this is a bad idea. And when you have 3.5 minutes to discuss matters, sometimes it's easier just to go ahead and let people shoot themselves in the head. And that's pretty much what this does, because these antibiotics clear your gut in a bad way. They'll take care of the few pathogens that might be present in your upper respiratory tract, but they do and wreak havoc on the rest of your body. So you're supposed to have a normal microbiome, is what we call this, in your gut. You're supposed to have a normal microbiome in your urinary tract. You're supposed to have a normal microbiome in your respiratory tract and on your skin. And these bacteria are different. Now, here's something else that's kind of cool. okay, the bacteria will change from the beginning of your gut to the end. Well, when you think about it, that makes a lot of sense. You know, if the lower end of your GI tract is real dirty, the stomach is pretty sterile, they would change. But what you don't necessarily know is that for every 5 or 10 feet of the small bowel, it changes as well. Okay, so what's good and what's bad with regard to the bacteria may change with regards to where you're located in the GI tract. The amount of data that's being gathered on this is astronomical. You can go read about it in Nature. You can read about it in Science. Some pretty decent journals go into great and nauseating detail about what little is known about this and what direction we need to take. So why am I mentioning it at all? Because it is very, very important that even with incomplete data, with incomplete knowledge, but a sense that there's something that you need to do, you can, in fact, take action. The first thing you need to do is cut back in your steroid use. Okay, you know, those nasal, those nasalides, the Flonasas, these things are marvelously overused. They inhibit your body's ability to fight infection by changing the way the bacteria grow as well.
Ooh.
Okay, this leads to things like Clostridium difficile, C. difficile. Okay, it'll lead to MRSA and many other really nasty infections that people are now starting to pay attention to. Necrotizing fasciitis, flesh-eating bacteria, was a big one some years back. You know, it's still there. We still see it. Okay, and it really is pretty nasty when you get it. It's not a happy place to be. So resist the temptation to ask for an antibiotic when you have a simple sore throat. You are going to clear it. Ask and resist the temptation to do the same thing with sinus infection. There are so many things you can do to treat and clear these processes without needing an antibiotic.
But let's go back to the first 3 or 4 minutes of the interview and talk about effective probiotics. How do we know? It seems to be a trend right now. Everybody's talking about them. Everybody's buying them. But every time I hear us mention them on the show, people are not buying them in proper dosage.
Well, that's the key. It's the dosage, it's the delivery system, and the bacterial choice. So what I typically tell people to do is to bring all their junk with them into my office and lay it out on the desk. And the good ones do, because they understand they're going to get value out of the interview if I have all the data, or at least the majority of it. And one of the things I tell people not to do is to buy their probiotics or much of anything else in blister packs or boxes. Okay, there are very few things that need blister packs or boxes. What this generally means is you're overpaying.
Right.
So when you're getting a probiotic, it should be in the counts of billion. Now, 30 billion, 50 billion, we're soon to be looking at 100 billion count probiotics. Now, why is this important? Okay, what bug is important? Bifidophilus species. There are many different bifids that you need to look for. So that's 50 billion Bifidophilus. Okay, so the dosages have to be right. Not 1 billion, not 800 million, but 50 billion to 100 billion. Now, what else is important? And this is probably the single most important thing I'm going to tell you, and that's that you have to take the probiotics appropriately. When do you want to take it? If you take it on an empty stomach, what do you think that's going to happen when that probiotic, which is a living organism, by the way, hits your stomach acid? It's going to be a fizzy. Okay, it's going to get eaten. Yeah, it's going to get eaten up pretty quickly. So you just wasted your time and money. Second problem, okay, is what do? Do you take it with meals or do you take it around meals? The best way to do it is in the middle of your meal. That way the bacterium is protected by the food. It stands a reasonable chance of making it past the stomach acid. Now, here's the more interesting one, because I asked one of the world's leading experts on GI flora. Okay, this guy was just about as boring a speaker as you'd ever want to meet, but he's a pretty bright guy. Okay, and I asked the following question, and it went something like this: what's the effect of the GI flora by these medications like PPIs and H2 blockers, which are things you would know as Prilosec, Tagamet, Zantac, Omeprazole, so on and so forth? And he smiled and said nothing. He said, the jury's out. We know they're bad. What's the net effect? Change. Is the change good? Probably not.
Wow.
Okay, a big smile, because that was actually the take-home message for that meeting that guy was giving while I was down at the meeting doing other business, as it turned out. So what I'm going to suggest that you do is this. Pay attention to what you can do to influence your GI tract. That would be minimize your antibiotic use. And when you do, it has to be followed by a probiotic. The second thing is prophylactic probiotic use is probably a good idea. if you're going to do it, pick a good one. Use it properly. Make sure that the bacterial mix is good, the count is good, and that the brand is good. If you have to keep it refrigerated, that's another giveaway that it's probably not a high quality. If they're properly freeze-dried, that isn't necessary. Okay? And you do them on a daily basis unless you have something like ulcerative colitis, in which case you probably have to take twice as much.
Wow. All right, Robin, how do we find the Stages of Life, and can we buy nutraceuticals there?
Absolutely. In our health store, which is open during office hours, Monday through Thursday, 8 to 5. Our phone number is 407-679-3337, and we are located in Longwood at 1917 Booth Circle. That's right off of I-4 and 434. Our website is stagesoflife.net, and we're also on Facebook at Stages of Life Medical Institute.